Good afternoon, everybody. Thank you for tuning in today. My name is Tiffany DeBoer. I'm the Public Information Officer for Calhoun County.
And I'm Michael Barton, Director of Emergency Management for Calhoun County.
We're excited today to answer your questions about having a pandemic plan as we start the school year and how we can mitigate the spread of COVID-19 as we continue forward. And so can you give us a little bit of an update on how the county's doing and how COVID's doing within the county?
Yep, so we're in a lot better place than we were this time last week or especially 3 weeks ago.
Right.
We are seeing a steady decline in active cases, in new cases, which is a good thing. That's where we want to be. We're a little over 1,900 cumulative cases to this point, so to date. And so we're approaching that 2,000 case mark, but thankfully we're not there yet. And hopefully it's going to take us a longer time to get there because we've slowed the spread a little bit. In the last 2 weeks, in the last 14 days, we've had over 360 new cases, which if you think about that compared to about 4 weeks ago, that's much less than where we were at. We've had a steady decline since August the 1st. And so that's what we want to see is continuing to have that decline every day. And the progress that we've made in our county has allowed the Alabama Department of Public Health to put us in the low risk category. So now on the map, it's changed from we have been red and we have been orange, now we're green. And that's where we need to be.
Right, because we were very high risk probably 2 weeks ago.
We were, that's right,
that.
and have been that way for a while. So that's some good news. People are doing the right things and we're seeing some progress. The unfortunate part of that, though, is our deaths have definitely been very high over the last couple of weeks. Since August 1st, known deaths that we've had, we're at 25. 25 people that we know have died from COVID-19 in Calhoun County in only the last 17 days.
Right.
It's incredible when you think about that many deaths in that short amount of time. On the official count that ADPH has, we're showing 21 total deaths right now. Those other deaths that we talk about, they're those deaths that we know through the Unified Command have passed away through the that the coroner's reported or the hospital's reported or that one of our long-term care facilities have reported, and the health department's investigating those to make those part of the official count.
Right, and they just look into it to make sure that the person passed away from COVID-19. That's why
right.
It takes a little while.
Right, that it's truly a COVID positive death.
Right.
And that was their contributing or main factor of death. That's right.
Okay. So we've seen a decrease in at least weekly cases and daily cases over the past week or two. Why do you think that we're starting to see the decline now?
So I think that, folks saw the seriousness of it in this county. Just a couple weeks ago, we were at the tipping point as some of our hospital and Unified Command officials have characterized it at. More cases than we have ever seen. Serious cases, hospitalized cases, ICU cases, people on ventilators, and then the deaths that we talked about. So I think people see that. It went from numbers to names. It went to, instead of just talking about statistics, to I know these people now that are becoming positive with COVID, or I know these people in the hospital, or I know these people that are passing away. It's our family, it's our friends, it's our coworkers. So we've been more personally affected. And once people are more personally affected, as we saw last week when we had our press conference at RMC, we heard from some survivors and we heard what their firsthand experience of having COVID-19 was. And so I think when we as individuals realize that it's here and that it's affecting us and people close to us, then that makes us take these precautions serious. The mask wearing, the social distance, and all those things that we've talked about, I think that that we've seen that, and now we're seeing the positive effects of how it works.
Right.
We're also about a month into the governor's mask mandate, and so I think people realize that individual responsibility. They've been wearing the mask because the governor said to, whether they wanted to or not. But I think now we realize that, yes, it is a good thing. It just makes sense. And so I think we're reaping the benefits now of what we started back about a month ago.
Right. And I remember you saying back when the governor had announced it was that if it doesn't, nothing, it at least raises awareness of how serious the problem was.
That's right.
About, the rising numbers and cases and deaths and all that in Alabama. So, it is a good sign for sure. So we know that school's starting back. A lot of schools are starting back this week. And And in light of that, part of the reason that we're wanting to do the Q&A today is to really encourage people to have a plan and to prepare. And, obviously we put in the prevention measures, but to prepare and have a plan for COVID-19. And so how can families and teachers be prepared as we're having to go back to school now?
Right. So it's that having a plan before you're affected by it. It's just like we talk about for severe weather for years.
Right.
Emergency management officials have talked about have a severe weather plan. Where are you going to go? If you go under a tornado warning, where's your safe place? All those kinds of things. It's the same thing for COVID. We know it's in our community. And we know that more people are going to get it. Now, hopefully that's at a slower rate and not as many people get it as at one time as what we've seen over the last couple of weeks. But we know with school starting back that some people are going to be infected by it. And so from a student, faculty, and then bring that home to the family standpoint, I think it's something that every family needs to have a pandemic plan. And so I really think there's three components to that. One is prevention, two is preparation, and three is perseverance. So the three P's of a pandemic plan: to prevent it, to prepare for it, and then to persevere through it.
Right. So can you elaborate? I mean, we've been talking in encouraging a lot of preventative measures, but can you kind of explain that a little bit more in depth?
Yep. So, we continue to understand, what it all means. And we've talked since the winter about what are these preventative measures? What are the precautions? And we all know, and they can be summed up now in three easy things to remember. The three W's: wash your hands, practice good personal hygiene. The second one is wear a mask. We all have our masks. We all wear our masks now, and we've seen the positive effects that's had in our communities. And third W is watch. Watch our distance. Make sure we're staying 6 feet apart, and make sure that, if we don't have to be in crowds, that we're not in crowds. So wash, wear, and watch are the three main things we can do to prevent further spread in our community.
Yeah, well, that's a good way to put it. Very easy to remember, for sure. So apart from doing all these preventative measures, what are other ways that we can prepare and help to mitigate the spread within our households or just in the community? How can we prepare for COVID-19 and exposure to it?
So we've talked a lot, at least through the Unified Command, about pandemic ready plans for organizations, and that's been our really focus point from the Unified Command, is to be making sure that our public safety, our hospitals, our local governments, our schools, those organizations have a plan and are ready. And so now we really want to look at and focus on what's that individual and that family plan, and preparation is important in that. So some questions that families need to look at and ask themselves and sit down and have this conversation is, if they were exposed or if they begin to have symptoms, where would they go be tested at? What are the local test sites that are available, and how would they go about doing that? We get calls in the Emergency Operations Center almost daily of people asking, hey, where can I get tested at? Or how do I go about doing it? Does it cost? Does my insurance, does it cover it? So all those questions are questions that need to be asked before you're actually dealing with it.
Right.
So in addition to where to go be tested, then I think the next thing is, while you're having to be isolated and waiting on your test results to come back, or if your test result does come back positive and you're at home having to quarantine, then what are you going to do?
Right.
That's 10 days or 14 days is a long time to be there, to be in one place without being able to get out and interact with people. And so what are you going to do in terms of supplies, medication, food, all those things? Do you have enough on hand that would last you that long? Or do you have a good support network in place of people that you can call that can help bring you supplies, leave it at your door, and that you can get it without having to expose them? But then even drilling it down further is within your household. If you're having to quarantine at home and you have other family members in the house and you're the one that's positive or you're the one that's been exposed, where are you going to isolate at so you don't take a chance on infecting the rest of your family? Is there another place that you can go, or that the other family members can go, maybe that haven't been exposed yet, to another family or a friend's house? So all those things are things that families and individuals need to look at and talk about before it ever strikes their household.
Right.
And it makes things so much easier, even because it's a high stress time regardless. We're all stressed. We all have those stressors in our life. just with the current state of the pandemic. And so by answering those few simple questions, it makes things a lot easier and you can respond a lot more effectively as a family.
Right. And I remember, probably a couple months ago when we were really getting into the COVID-19 pandemic, me and my mom sat down at the kitchen table and we were just like, okay, what's our plan? If one of us gets it, because, we work at different jobs and stuff, so she could be exposed before me, and then how would we prevent her from exposing me? And so we decided, we have this room, there's a bathroom, its own bathroom, there's a TV, we can stick a chair in there, and, you're able to isolate away from the rest of the family so that we wouldn't expose anybody else. Because, we've heard of people catching it lately from other family members that have had it.
Yeah, we had, at our press conference last week, we had several COVID survivors that came and talked. And one of them talked about how, they were doing all the things. They were practicing all the wash, wear, and watch, when they were out and about. But a lot of times when we're in that family setting or in a social setting, we let our guard down a little bit. And one of their other family members actually brought it into their house, and they thought it was just a stomach bug, but it was much more. So we have to be hypersensitive about any signs or symptoms and make sure that we take those very serious within our own families.
Right. And another thing that I was thinking about as we're going back to school, that is also up to our children in the community to understand the severity of it. And so, would you recommend that parents sit down with their kids and really encourage them to wear their masks, to try to, socially distance from their friends and things like that?
So I'm a parent. I have 2 kids. They actually started back school today. And so we didn't just have that conversation last night on the day before school started. We really looked at over the last few months of just modeling that behavior when we're out and about, which, we've limited where we go and what we do, especially as a family. But we do go to church, and if we have had to go to a function, maybe a family, event or something like that, that we've modeled that by putting the mask on. And they've had their mask for a long time now, and they've kind of gotten over the newness of wearing them. Right. So I would encourage, families to, to do that ahead of time and to do that as often as they can. And it just be something that, well, I got to put this on because I have to do it. But it's something that is more of a habit and more of a lifestyle change for where we're at right now in the middle of this pandemic.
Right. And I know from, me personally, I'm used to it now. I just put on my mask when I leave the house, grab an extra one in case.
That's right.
And
it's second nature, and that's what we've got to encourage our children. And it's hard. Mine are very young, kindergarten and 3rd grade, and it's hard, for them to do that. But over time, they get used to it. Over time, they take it serious because they watch us and take cues from us. And so, they've been troopers with it. Not that they've been happy about it every time, but, it's just one of those, an additional thing that they have to understand why we're doing it. For them to be willing to do it. And largely our experience has been, they have done it so far.
Right. So we know that, this pandemic started way back. We were dealing with it in Calhoun County back in February. So it's been here a while, and it will probably be here for a while. So do you have any advice to the community about how to really continue forward, as the pandemic continues?
So I think we just have to persevere. Yeah. We have to be patient. We have to know that it's not going anywhere, not going away anytime soon. And so we have to look at it as a marathon and not a sprint. Right. We're in this for the long haul. The experts tell us that a vaccine, it's coming, but it's not here yet. And even once they get one developed, then there's a lot of trials and tests that they have to go through to make sure that, it's not going to be more adverse than what the infectious disease is itself. Right. And so there's all those processes that have to be done to make sure that it's safe. Other experts have told us really the only vaccine that we have right now is those 3 W's we talked about: wash, wear, and watch.
Right.
And so in doing that, then we have to keep in mind that, and we have to keep that perspective that we're in it for the long haul. It's going to take a while. And so we've got to have that marathon mentality, and we've just got to set our minds to it and press forward. Taking it a day at a time and knowing that, there's no end in sight yet. We just got to do our best every day.
Right. And, we're seeing the results of taking it seriously. And so that's encouragement as we move forward. Yeah,
we've been through a really difficult time over the last few weeks in Calhoun County. And now we're seeing the the results, like you said, of those precautions, that it works. But it's not something that, even though we're on a downhill slide right now, we know that it's probably going to come back at a certain point. We're going to ebb and flow through that. That's what the experts tell us. That's what experiences when we look at other places tells us. And so we've just got to have that mental toughness about us, and that mindset that this is just what we have to do for this next extended period of time in our lives.
Well, so when preparing for a pandemic plan, you can go to our website, calhounema.org, and under one of the tabs, it's labeled COVID information. And there's additional resources, and there's a nice graphic on there with some pictures and text that kind of sums up all this about how you can prevent and prepare for COVID-19. And I also wanted to, earlier he mentioned to know where you will get tested beforehand, so you're not having that added stress once you've been exposed or once you start to develop symptoms. It helps to reduce the stress when you have that plan. And I'm just going to read through just a couple of the test sites that we have in Calhoun County. So a couple of them, we have 4 in Calhoun County. So Calhoun County Health Department, the RMC Mediplex, Southern Immediate Care, and CARES Plus. So these are all places that do testing. You do have to have an appointment, and you can call those places and ask more information about cost and time and when you can go, when you would be able to go and get tested. So it's good to have those in mind for your plan. Have specific places that you would go if you were to be exposed. So we do have some questions that were sent in by some of our media partners that I will start to ask. So the first question for you is, when a college student tests positive for COVID-19, are they counted among the positive cases in that county where they're in college, or in their home record from where they came before campus?
So my understanding is from the health department officials that it's what address that they provide. So when you go to get tested, there's usually a form to fill out, and you provide your name and all your demographic information, including address. And so it'd be the address that they provide. So I would encourage people to provide the address of where they're actually residing at that current time, because that's what's most important, is for us to know where the cases are at and what the level of spread is. Those are the appropriate resources can be put in place in that general area.
Right. And so as a student, they are in our county and they are here in our community, and so it's good to know that they're testing positive here.
That's right. Yeah. So if they're staying in an apartment or a dorm here in Calhoun County, then that would be the address to put down, because that's really where the case is at. Is not, back in their home county. Right.
That's a good point. And so this is another question. Will there be an alert system to let the public know if a COVID-19 outbreak causes a K-12 school to close?
So, we talked about earlier, I think, that the schools have been part of the unified command and the task force from the very beginning. So they've got good plans in place, good procedures. They've been training on it. They've been working on this, and it's a fluid situation. The superintendents, I talk with them weekly. They'll tell you this is a very fluid situation, and we're learning lessons from other school systems, from best practices that are occurring throughout the country and the state, and even I think we'll learn lessons from other schools within our county. Right. And so we have to pay attention to all those things. So in doing that, those plans are in place to make appropriate notifications as outbreaks may occur at the local school level or throughout a school system. And so those notifications through this will go through from the school system to the parents, to the faculty, and then from there they'll make a public release of what's occurring and what their action steps are in moving forward. Now, from the Emergency Management Agency, we will support those efforts in terms of helping that messaging. And it'll be the very same that we always do for inclement weather. When schools make decisions to close or have delayed starts and those different things, we're partners in that with them, and we help with that messaging. We help provide data and information for them to help make the best decisions during that time. But also, this is no different. We do that in the COVID environment as well.
Right. And so you did mention having weekly calls with the superintendents. How has EMA and the Unified Command worked with the superintendents throughout this process?
So they had representatives of the school systems on the original infectious disease task force that we stood up back in February. And so they've been partners in this ever since. And so through that, they've been able to have the most updated and most relevant information available to them for all these months now. And then once we transitioned over to a unified command, then we set up a working group that was specific to help support our school systems and our superintendents. So from throughout the unified command, we brought in experts, our local subject matter experts, so that we weren't necessarily reinventing the wheel, but best practices maybe that was put in place at the university or at the hospital that the superintendents and that their staffs had accessible to them. Hey, here's some ideas, here's some best practices, and they can take those back and incorporate those into the schools. And then we maintain those weekly calls and that communication so that if any specific need that they have, the Unified Command can work hard to gather that information for them and help provide that to them and support our schools in any way possible.
And so having worked with the schools and, seeing the numbers in the county and stuff, how ready does Calhoun County appear to be going back to school and accepting students, at JSU, and kind of where does the county stand, and are they prepared for it, and are we ready for it at this time?
So I definitely think they're as prepared as anybody can possibly be. I think there's a great framework in place that covers, that goes through their pandemic plan. I think they've done a good job on making their decisions in terms of start dates.
Right.
And they've pressed it long enough that they've been able to get staff trained up both in pandemic precautions and those practices they're going to have to employ during in-person classes, but also on the virtual side that they've made that available. And I think it's important to have those different choices for families to make because it's not a one-size-fits-all. And so I think for the most part throughout Calhoun County, our schools have offered that, and they've been very sensitive to that. So I think they're as prepared as anybody would be. As the superintendents will tell you, it's a fluid situation, and it does change, and it will change. There's going to be cases in schools. That's just the reality, of the matter. But I think it depends on, how well folks follow the precautions, and how serious they take them will determine what the total outcome will be.
Right. So one of the questions that were submitted was about a school in Limestone County. They started school and then ended up having to suspend classes because the virus kind of started spreading throughout the school. So is that something that you are prepared to do if the same scenario develops?
So we don't actually do that through the Emergency Management Agency. Again, that's a local school system decision. And I think those decisions are made best at the local level because what's going on in a particular school, in our particular school system, it's up to that superintendent and that Board of Education to decide what the best course of action is. And we know they have good plans in place now. They have good resources. And they continue to learn and to train. And so I think they'll make definitely the best decisions at the time that comes.
Right. And so what is your biggest concern as we're going back to school for college and, K-12 schools? So
I think a video that was on the national media just earlier today about a university somewhere in Georgia, and they were having these big parties over the weekend and hundreds, if not thousands of people in close quarters without masks and all these type of things. No precautions being taken at all. And that's my fear, is that people drop their guard and they don't take it serious. And so my encouragement would be to stay the course. Remember that it's a marathon. It's not a sprint. We're in this for the long haul. And that even though these things they feel like they get in the way of life, we can still have life and still exist in this environment if we put these precautions in place.
Right. And we do know from the data shows that, young people are getting infected by it, even though that they may not perceive themselves at being high risk, but that it is important that they take it seriously because of other family members and other high-risk members of the community.
That's very true. Because they may go home and, they're going to have higher risk family members there, at least older family members. They may have those special situations with very high-risk people in their families. The college students may have, a workplace that they go to, and they may have coworkers that they have to be considerate of. And teachers and faculty and staffs at the schools, those we have to be considerate of those as well that are older sometimes. And so it's important for, regardless of what age that we are, for us to take it serious and to do those things that the experts have told us to do. And we know from our recent experience over the last few weeks here in this county that they work.
Yes. Okay. So because we have been seeing some downward trends statewide, actually, with some of the data, do you think that the governor will extend the mask order?
So I have no inside information right now that would tell me if the governor and the state health officer plan to extend it or not. I think, though, based on the results that we've had over the last month that the order has been in place, that we have seen a steady decline in cases statewide and including in this county, that it would be hard for the governor and state health officer not to extend the order at least another month to see where that gets us in terms of community spread.
Okay. So I do, so that's all of the questions from our media partners. I do have one question from Facebook, and then we can probably take a few that have been added during the live chat. So the first question is, what should I do if a family member within my home exhibits symptoms or tests positive?
So that goes back to where we're talking about having that plan in place within your home. So you want to isolate the best you can and to minimize exposure with other family members.
Right. And I know we had done a video, a PSA a couple weeks ago, well, probably a couple months ago, with Nanette Moodian from St. Michael's. And she kind of went over a lot of specifics almost, wash your clothes with hot water and don't use the same plates as somebody or pass cups or use the same utensils.
Disposable throwaway stuff's probably best in that very situation.
Yeah, exactly.
And have a separate trash set up for the person who may be sick or exposed to be able to use, that it totally doesn't, expose anybody else in the house that way.
Yes. All right. And so now we'll open it up to the Facebook Live if anybody has questions.
Where can you receive a rapid test in Calhoun County?
Rapid test in Calhoun County.
Yeah. So I think a couple of these places that you went over earlier,
Southern Immediate Care and Cares Plus, I believe.
I believe they offer a more rapid test.
Mm-hmm. I believe the health department, correct me if I'm wrong, if you've heard something different, but the health department, they're about 3 to 5 days still. And then Southern Immediate Care, I believe, is faster, but they do charge your insurance. So it's health department's a free test, and Southern Immediate Care and Cares Plus will be ran on your insurance.
How long do you expect COVID to last before life can return to normal?
So how long is COVID going to last is the question. Well, like we talked about a few minutes ago, there's no end in sight. It's the new normal for now, these precautions in place. And, until there's a true vaccine and immunity is built up, just like with other infectious diseases, I'm not an expert by any means, but just like, as we've seen throughout history, that, it takes a while for these things to happen. So we got to remember that it's a marathon. It's not a sprint. We're in it for the long haul.
Yeah, it's just a mindset you got to get in now.
That's right.
You have any more? No? So no more questions from Facebook. All right. So do you have any last remarks or words for Calhoun County?
So I would just encourage folks to remember to have a plan in place, that pandemic plan, to prepare, to prevent, and to persevere, that we're in it for the long haul. And of course, as always, we're here to help. Folks can get more information and the updated information from Calhoun EMA on our website at calhounema.org. We also have several different social media platforms, Facebook, Twitter, and Instagram. And as always, if somebody has a question, needs assistance, feel free to call us at the office at 256-435-0540. And the 211 helpline is always available 24/7 for folks who may have specific needs in the community.
All right. And so with that, I do want to thank all of you for tuning in, and I'm glad that you guys submitted questions. So our next series, we plan to talk with more on the medical side of things. So if you have any questions about medical or related to medical aspects of COVID-19, you can submit those to us for the next session that we'll be doing next week. You can do that by going to our website, calhounema.org, under Contact Us, and there's forms that you can fill out and get in touch with us. And we just thank Michael for giving us his time and talking with us today. So thank you.